Okay, thank you. Thanks a lot, Ms. Rheam, for being with us today and giving us this wonderful opportunity to have this conversation with you.
Thank you.
So, being here as the clinical dietitian of Gulf Diabetic Center, when did you join GDC?
I joined the GDSC May of last year, so May of 2014. So I've been here about 9 months now. That's when I joined. So, and I had moved to Bahrain. I moved to Bahrain about a year and a half ago.
Okay.
So shortly after I joined.
Okay. Yeah. And so why did you want to be a nutritionist or a dietitian? What inspired you to choose this as your career?
Well, I've always been interested in nutrition and food and what happens to food when it's in our bodies, and how basically what you eat determines your weight, and not only that, but it also determines whether you're at risk of any, chronic diseases, you're at risk for any other diseases related to your weight. So also I'm very interested in public health, which is something that I did. I did my master's in public health after I did my undergrad, and basically I worked a lot to help people in terms of nutrition. So, combining the public health with my interest in food, being a dietitian basically helps me help people choose the right foods to either prevent diseases or to manage them. That's basically why.
We saw in your profile that you have been into the public nutrition, the micronutrients. So you have been in that cycle, and you have been with the society, taking into consideration of those part of the world where these things have really needs to be seriously considered.
Yes.
And you have traveled to all those places, and you have seen a lot of things.
Yes.
So tell us about that, how the experience has been.
The experience was very different to a place like Bahrain. So before I moved here, I did a lot of work in Lebanon with different populations, like the Syrian refugee population. Before that, I worked in Ethiopia for a while with the Somali refugee population. And basically what we were doing, I was there with an NGO. And let's take Ethiopia as an example. So it was in the south of Ethiopia. About 200,000 Somali refugees infiltrated into Ethiopia, and basically there were about 5 or 6 camps set up. And the rate of malnutrition, micronutrient deficiencies was was great. There was about 40% malnutrition, maybe 25 to 30% children were stunted, so their height was low for their age, and that basically happens when they're not getting the right nutrition from the time of when they're preconceived and then up until 2 years. So while they're in their mother's in the stomach until they're born up to 2 years. So that's a very critical time to get optimal nutrition. And a lot of these kids weren't getting optimal nutrition at that time, so they're stunted. There were lots of micronutrient deficiencies like iron deficiency, vitamin A deficiency. So the program was basically, targeting these malnourished people, lots of women and children. So we set up programs, supplementary feeding programs and micronutrient supplementation programs, and also a lot of education programs on, maternal and child health and child feeding practices, breastfeeding, the right way to feed children so that they get their optimal nutrition. So that was a really, really good experience for me. It was life-changing, basically. You really appreciate what you have, and you realize that in this part of the world the problems are basically the opposite. People have diseases, and as you get older they're dying of chronic diseases because of overconsumption of food, while in those situations it's because of underconsumption and malnutrition. So it's really the two sides of nutrition that I've been involved in, and it's really nice to see both of those sides.
So what is the major problem that has come to you after coming to Bahrain? One of the major issues with which patients walk into your room, what has been the most common one in here?
Yeah, well, being at GDSC, so this is a diabetes specialist center, I see a lot of diabetics. And I see also a lot of people who are overweight and obese. And I think this is, in Bahrain, this is the public health problem, mainly. So overweight, obesity, which lead to diabetes, other chronic diseases, complications of diabetes, so kidney diseases, heart diseases, high blood pressure. So, lots of patients have multiple problems, a lot of those issues at once. And working here is good because I get to basically see patients that are overweight and obese and hopefully prevent diabetes, because there's lots of pre-diabetics out there that don't even know that they're pre-diabetics, they call it the silent disease, or until you reach a stage where it's really hit you and you're diagnosed as a diabetic, sometimes you can't ever tell. So the biggest risk factor is overweight and obesity, one of the biggest risks. So treating that and dealing with people to get to a healthier weight will make the difference in whether they become a diabetic or not.
Okay.
Yeah.
So since you said about diet and the connection between diet and diabetics, does a crash diet help a person, an obese person or an overweight person, maintain their weight and make sure that they don't get any of these diseases? Does crash diet has any meaning? Like, there are a lot, if you go to the internet and search, you get so many diet plans. Like going for fruit diet, and there is liquid diet plans.
There's lots of diets out there.
So and what is good for me? So that's the question that most of the patients might be having.
Exactly.
So how do you find that out?
So there's a difference between weight loss and health. If you want to lose weight and you purely want to lose weight, crash diets will work. Crash diet is designed for you to lose weight. But is it the healthy way to lose weight, and is it the sustainable way to lose weight is the question. And that's when my answer is no. And I am against all crash diets. It's really not rocket science. It is just a lifestyle change. It's just cutting down portions, having a balanced diet, choosing wholesome, clean foods, unprocessed. Basically feeding your body the right things, the things that it needs, in combination with exercise. Obviously, it's exercise and diet come hand in hand. And crash diets, basically, most of them you're losing water weight, muscle weight. You're not losing what you should be losing. And the way to lose fat and gain muscle, get a higher proportion of your body to be lean body mass, which is the one that's burning more, your metabolism increases. That's what you want to do because you want something sustainable. Crash diets usually end up, you lose X number of kilos and then 2 months later you're back up. So that's not the solution, and people just struggle with that for years and years and years. And if the solution is a change in lifestyle, and it's a lifestyle change, something that you will continue to do for the rest of your life, something that's not drastic, something that's completely doable, just with the right resources, the right knowledge to know what to choose, the amounts to choose, and making small changes to your diet. So with a lot of my clients, they don't feel like they're really on a diet per se, they're just changing their eating habits or adding a few things to what they do throughout their day, So I really don't like the word diet. That's not, I try not to use that, my clients are not on a diet, they're just coming to improve their lifestyle and their eating habits. So that's kind of my take on it.